Hospitals can certainly be scary, especially if you don't understand healthcare issues, medical terms, and all the things that are going on around you. Janine, why did Albany Medical Center decide to work with a video content production company to develop animated health education material?
For us, we are a pediatric unit that serves kids from 0 to 21. And the one thing that all children have in common is that they all love a good story. And from the time that they're little, they used to having stories told to them. And whether they're infants or toddlers or even into teenage years, into adolescent years, everybody can relate to a good story. And for myself even, I know that when I was going through school, including my master's degree, the best things for me were to relate everything to a story. I still remember stories from my childhood, though I may not remember what I ate for breakfast. The ability to remember a story is a lot easier, especially for a child. And most of our parents relate to stories as well. I mean, they say that the average adult is, considering reading level and everything, is 3rd to 5th grade. So storytelling works for just about everybody, including our parents too.
Medical information can be overwhelming and even just downright scary for patients. What made you choose animated videos for introducing healthcare concepts to your patients?
Nobody gets scared when they look at a cartoon. Cartoons historically aren't scary. Now, I mean, maybe some of the Bugs Bunny cartoons, and whatever, when they blow everybody up with TNT, but for the most part, cartoons aren't scary. And the one thing, again, that you can remember as far as early back as you can go is children all watch cartoons, whether it's like an educational cartoon, like a little Einstein or anything like that, up through even teenagers are watching cartoons. Cartoons are in the movies. And there's something about a cartoon character that everybody can relate to. They're funny. A lot of times they're funny looking, so kids think that's funny. And they're memorable. You remember a cartoon character's name, like I said, a lot better than you remember, your ABCs or something like that. And cartoons are kind of go forever. There's kids today still watching, Bugs Bunny and the Flintstones and those cartoons. They don't sort of outdate themselves. We try to not get too specific about certain things just in case the way they do things changes in the future. But pretty much an X-ray is an X-ray and an MRI is an MRI and those kinds of things. I think when you're doing something like this, you don't want to get, like I said, too specific because then you have to keep changing it over and over again. The more broad you keep it and the simpler you keep it, the longer the shelf life is going to be.